during this period of time, your body is trying to get you pregnant by all means. On this particular episode, we're going to talk about, when women have different types of discharge. Throughout your cycle, you have different discharge. So at the beginning of your cycle, you've just had your menses. After that period of time, the mucus will begin to become a bit thin as you approach your ovulation period, so that it is able to accommodate sperm. So in simple terms, during this period of time, your body is trying to get you pregnant by all means. So the women will have a nice glow on their skin. However, some women have a pain called a Mitchelmer's pain. These are ovulatory pains during that time. But generally, the woman is a bit more excited. The libido is higher. The skin is glowing. She's really feeling good and she's feeling herself. This is your body trying to trick you into having a child. Not to mention that the cervical mucus or the discharge that you're coming from your uterus is much thinner, like egg white, yeah? And it shouldn't miss milling really anywhere weird. After you're done ovulating, now the mucus begins to thicken as the progesterone levels begin to increase. The body is basically assuming that you're now pregnant, so it makes a thick plug of mucus. It's like as if a gate, like a fund is at the gate, or there's nowhere you're crossing, because here we're now protecting something good inside here. So when you do have this particular thing happening, the mucus is much thicker, it is white. It shouldn't have any color that is strange. It shouldn't be like spoiled milk. It should just be a smooth white consistency, more like yogurt, and shouldn't smell strange. This mucus particularly will normally be an indicator for the time when you're safe, or when you're that safe period of time. And even women, when they are pregnant, they will normally have this discharge that comes sometimes. But if it's anything that is too much, by all means you have to make sure that you report it. If you have a discharge like spoiled milk, we like to call it cottage cheese, make sure you also get to the hospital as soon as possible, as that often is an indicator for vaginal candidiasis. Or if you have a mucus plug, anything that is greenish or off yellow, any color that is strange like that, those are all poor indicators. Now, Shea Health gives us these mini pads. So they have the mini pads here. There is the shorter mini pad, which is the green one, is the shorter mini pad. And then there is the yellow one, which is the longer mini pad. Okay, so the whole point about the mini pad is that for it is a smaller one. Normally it helps with like people who have like a very small flow of menses, or if generally you have discharge. So this particular one helps to protect you in that period of time. So when you're having a discharge that's funny, you can use any of these two options, or on the last days of your period if you're sporting, or people who often sport, who are having like people who are on any methods of family planning that cause them to sport. These are methods that you can use if the period is not heavy.